So for this short video that is supposed to enhance your critical thinking, let's look at the phases of burn. Okay, so we have three phases of burn. We have the acute phase, we have the emergent phase, and then we have the recovery phase. To make it easy, you can spell out the word EAR, E-R. No, that's not how you spell ear. Ear, E-A-R, which E stands for emergent, A stands for acute, and R stands for recovery. So for the emergent phase of a burn, okay, so these are phases of burn management. For the emergent phase of a burn management, as a nurse, what you should be worried about at this point will be hypovolemia. So your patient is at risk for hypovolemia. Why? Because when we went over what is happening for your burn client, we talked about them losing electrolytes and all of that. If a patient is losing electrolyte, that means they're losing volume, right? They're losing volume as well. So high risk for hypovolemia. So if a patient is at high risk for hypovolemia, that means that they can easily go into hypovolemic shock. So now, as a nurse, how would you know that your patient is going into a hypovolemic shock? Just start with the vital signs, okay? Everything goes up except the blood pressure, okay? So everything goes up except the blood pressure. That's how I easily remember it. So for example, they'll have low blood pressure, their heart rate will be high, their respiratory rate will be high, they'll have anxiety, they'll be feeling this impending doom, just anxious. So everything is hyperactive except the blood pressure. That's how you be able to determine that they're probably going into hypovolemic shock. So your patient is very anxious, anxiety. You're looking at their heart rate, they are tachy, greater than 100, but then their blood pressure is just dropping. So this systolic blood pressure will probably be under 100. So I want you to know that when you get your patient encounter, right, get a baseline. If you started with a patient that is a burn patient, your baseline is 120 for blood pressure. Systolic blood pressure is 120. Then if suddenly they leave from 120, even if they are 101, that's a big change, right? That's a big change. Then you turn around, if you look at their heart rate, they're beginning to be tachy when they were normal before. That means a patient is going into a respiratory distress and they're going into hypovolemic shock. So that's the emergent phase of burn. Watch for hypovolemic shock, okay? The acute phase of burn, this is where now that the patient is diuresing. So this is the diuresing phase. Usually greater than 48 hours of the burn, this is when they start doing their diuresing phase. For this phase, what we're focusing on as nurses is infection prevention and pain relief. Okay, so you want to manage pain seriously in your acute phase, and then you want to focus on infection prevention. So if the burn was on the skin, and remember when we mentioned about the immune cells rallying for a burn to be able to see if they can fix the issue and if they can resolve the issue or not. So we're focusing on infection prevention and pain management for our acute phase. Again, these videos are meant to enhance your critical thinking as you read your notes. This is a supplement. Then for the recovery phase, we should all know what recovery is, right? As a nurse, what you're thinking of is like physical therapy and occupational therapy. Okay, so what will physical therapy and occupational therapy look like for my patient in relation to burn? If my patient had a kind of burn that will relate to disability, so this is where your recovery phase, that's what you're thinking of based on your scenario, your patient scenario or your case study and all of that. So these are the three phases of burn management, which we use the word EAR to be able to help us remember. E stands for emergent phase, A stands for acute phase, and then R stands for recovery phase. And I'll go back to acute phase. For an acute phase of burn, I think we've already established that in a burn patient, they have hypermetabolism. Very first video I mentioned I made mention on that hypermetabolism. In the acute phase of burn, right? Okay, your patient is in hypermetabolic state. So if a patient is in hypermetabolic state, it means their metabolism is working like fast. So think of it, critically think of it. If somebody's metabolism is working really fast, are they losing weight? Are they burning calories maybe more than they're supposed to? Yes. So acute phase of burn, hypermetabolic rate, okay? This is what your patients will be experiencing. They'll experience weight loss. And then because there's been shift of electrolyte and stuff, they'll probably experience low proteins and low albumin level. So therefore, to be able to manage this, do you want to give them high calorie diet at this phase? Yes. So if they can't eat by mouth, then we're supplementing those high calorie diet, either TPN or maybe tube feeding, just whatever alternative that we have. So again, those are your phases of burn, and I'll see you in the next video.